My name is Dr. Niharika. May I know your name and age, please?
My name is Bhavan Kumar. I'm 20 years old.
Do you have any joint pain, neck pain, or back pain?
No.
Today I am going to perform musculoskeletal examination. Is it okay with you?
Yes.
Before examining the patient, we should sanitize our hands. Now we are going to perform the complete examination of the shoulder. Let's begin with inspection. There is no deformity, swellings or muscle atrophy. Now we are going to perform the palpation of the shoulder. This is the sternoclavicular joint. This is the clavicle. This is the acromion. This is the greater tubercle. This is the coracoid process. This is the scapula. Now we are going to perform the shoulder girdle range of motion. Can you flex your arm like this? Can you extend your arm? Can you abduct your arm? Can you adduct your arm? Can you do internal rotation of your arm? Catch your scapula like this. Okay. Now do external rotation. We are going to perform the crossover test. Can you please abduct your arm? This. Okay. Do you feel any pain?
No.
Okay. Our patient is normal. We are going to perform the apply scratch test. Can you please abduct your arm, touching your scapula upper side? This is called external rotation. Can you please adduct your arm by touching the lower part of the scapula? This is internal rotation. Okay. Do you feel any pain by performing this?
No.
Okay. Since there is no pain, our patient is normal. We are going to perform the knee impingement test. Can you please raise your hand? This compresses the greater tuberosity of the humerus across the acromion. Do you feel any pain?
No.
Since there is no pain, our patient is normal. Now we are going to perform the Hawkins impingement test. By flexing the arm, by placing the elbow at 90 degrees, while doing the internal rotation. Do you feel any pain?
No.
Since our patient is not having any pain, he is normal. Now we are going to perform the drop arm test. Can you please abduct the arm and the shoulder at 90 degrees? Can you please move it slowly down? Since our patient is able to perform the test normally, he is normal. Now we will be performing the empty can test. Can you please elevate your hands at the rate of 90 degrees? Now I will be performing the internal rotation. Please resist it. Since our patient is able to resist, he is normal. Now we are going to perform the complete examination of the wrist and hand. Can you please raise your hand? Now I am going to inspect your hand. There is no bulges or scars. Now I am going to palpate your hand. There is no swellings. Now we are going to perform the wrist range of motions. Can you perform flexion, extension, radial deviation, ulnar deviation? Okay. Do you feel any pain while
No.
doing this?
No.
Okay. He is not having any pains. He is normal. We are going to perform the grip hand test. Can you please grasp my fingers? Okay. This test function of wrist joints, finger flexors, and the intrinsic muscles and the joints of the hands. Now we are going to perform the Finkelstein test. Can you please grasp your thumb? Can you please move forward? Okay. Do you feel any pain?
No.
Since he is not feeling any pain, he is normal. Now we are going to perform the thumb abduction test. Can you please oppose my force? Since he is able to resist, he is normal. Now we are going to perform the tinal test. Can you please raise your hand? Do you feel any pain?
No.
Okay, our patient is not feeling any pain. He is normal. Now we are going to perform the phalens test. Can you please raise your hands like this? This maneuver compresses the medial nerve. Now we are going to perform the complete examination of the knee. Can you please stretch your knee? Now I am performing the inspection of the knee. As we see, there is no deformities, no scars, no muscle atrophy. Now I am going to palpate the knee. There is no swellings. This is the patella, this is the femur, this is the tibiofibula, and this joint is called synovial joint. This is known as ligament because it is bone to bone connection. We are going to perform the bulge signs test to watch the fluid mass. As we see, there is no bulges. Our patient is normal. Now we are going to perform the balloon sign test. Now I am applying pressure on the both sides of the patella. This is done for major effusion. I am going to perform the test for balloting the patella. Now I am going to apply the pressure on the suprapatellar pouch by moving the fluid downwards and watching if the fluid returned to the suprapatellar pouch. Now we are going to perform the McMurray's test. By doing the flexion and the external rotation. There is no sound is heard. Our patient is normal. Now we are going to perform the valgus stress test. By lifting the knee 30 degrees and doing lateral extension. There is no sound is heard. Our patient is normal. Going to perform the varus stress test by placing hand on the down of the patella and one hand on the heel. By performing internal rotation on the knee side and external rotation on the heel side. Do you have any pain?
No.
Since our patient is not having any pain, our patient is normal. Now we are going to perform the anterior drawer test. By placing my hands on the distal parts of the patella, by applying pressure and pulling the legs forward. There is no jerk sound is heard. Our patient is normal. We are going to perform the Latchman test by placing my hands on the distal side of the femur and the proximal side of the tibia by applying pressure. This is to estimate the degree of forward excursion. Now we are going to perform the test for posterior drawer test by placing my hands on the proximal side of the tibia by applying pressure. The tibia doesn't fall back. Our patient is normal.